So we need to proceed into the hypoglossal. I need to ask the client to produce tongue, the midline, and then move to side. Can you to produce your tongue, ma'am, then the midline, then move to side, and also in that other side?
Yes.
Say, can you open your mouth, then can you move it? So, based on my assessment, the client can respond and there's no problem. We will be continuing for the reflexes. So first on that, I need to test the reflexes of the percussion hammer of the client, both side, and also I need to compare it. So let's assume that I have a hammer here. So I need to so let's assume that I have a hammer. So I need to check the bicep and the reflex of the client. So I need to check the partially reflex and also the client arm on the elbow, and rest the forearm over the thighs and placing on the palm and on the hand down. So I need to check checking the biceps of the client. And in the other side. So there's no problem. So we need to proceed to place the thumb. So dominant hand horizontal bicep tendons, I need to deliver slight downward thrust with the percussion hammer to your thumb. And I need to observe the normal slight flexions into the elbow and feel the biceps contraction through your thumb. So let's assume that I have a hammer. Into the elbow. So we need to proceed into the triceps reflex. The flex, I need to flex the client arm at the elbow and support it in the palm and the dominating hand. And also I need to palpate the tricep tendons about 2 to 5 centimeter or 12 to inches. Then I need to deliver and blow with the percussion hammer directly to the tendons. So let's assume that I have a hammer here. So after assisting the client, we need to proceed to the plantar flexions, downward checks on the foot. To check the plantar ball banks is a reflex. We need to use a moderately sharp object such as the handle of the precosed hammer, a key or a dowel, a pen or applicator stick. So let us the sharp object. So I need to stroke the lateral border of the sole of the client foot, then starting to the heel, continuing to the ball of the foot, and then proceeding across the ball of the foot toward the big toe, and I need to observe the response. So the client can respond while doing the assessment of her foot into the toe down to the on her heels. So we need to proceed to the motor function. I need to gross motor and blank test walking guide. So I need to ask the client to walk across the room and assist the client. So can you walk, ma'am? Can you stand? Can you walk? And then can you back here? So based on my assessment, the client can walk and she return here. So there's no problem on her foot. So she can respond. There's no problem. So I need to check this will be the Romberg test. I need to ask the client to stand together and arms resting at the sides of an open then closed. And then also I need to standing on the foot with the eye closed and then I need to ask the client to close eyes and